at the effects. The effects of the change. The effects in the changes of the starling forces. Of the starling forces on the GFR, the RPF, as well as the filtration fraction. So we are going to look at this topic. So to begin with, we will list out the categories we are going to discuss. First column will be the effect. Then we are going to look at the GFR of it and the RPF, followed by the FF. That is the filtration fraction. It is nothing but the GFR divided by the RPF. So first, the effect will be, we are going to discuss the constriction. The constriction of the afferent arteriole, and example would be the sympathetic stimulation. So under this, the GFR is decreased and the RPF is also decreased, and since both decrease, there is no change here. Next, we are going to see the constriction of the efferent arteriole, and the example here is a angiotensin 2. So the GFR here is increased, the RPF is decreased, and overall the FF, the filtration fraction, is increased. So the GFR and the FF are increased, whereas RPF is decreased. Next, we'll look at in case of increased plasma protein. So in terms of increased plasma protein, the GFR, it decreases and the FF also decreases, whereas the RPF, there is no change. So in addition of plasma proteins, if it is increased, the GFR will decrease. They are inversely related. Next, we will see in case of the decrease in the plasma protein. So in increase, there was increase. In case of decrease in the plasma protein, the GFR, it increases as well as the FF increases, and there is no change in case of the RPF. Next, we will focus on the uretral stone and the constriction of the ureter. So in case of the uretral stone or the constriction of the ureter, so here the GFR will be decreased and there is no change, and there is also a decrease in the FF. So this was about the effects of the changes in starling forces on the GFR, renal plasma flow, as well as the filtration fraction. And we saw in conditions where it is increased and decreased. So to learn and grow daily, please do subscribe.